that. Perfect. Thank you so much. So we will first have a panel discussion among the panelists, and we'll then open up the discussion to the audience for a Q&A. If you have burning questions beforehand, of course, feel free to ask them in the chat, and we will make sure that the questions will be answered during the Q&A part. Shortly, I would like to tell you about us, about Digital Switzerland and our activities. So Digital Switzerland is a Swiss-wide cross-sector initiative that aims to strengthen and transform Switzerland into a leading digital nation. Our mission is really to coordinate and facilitate the process of digital transformation and to help Switzerland become a leading and fertile breeding ground for digital innovation. We are member-based with over 170 members and partners that collaborate with us on different Swiss-wide initiatives in different areas, such as education, e-sustainability, cybersecurity, and also digital health. The aim of the digital health program is to digitalize the Swiss healthcare system and to make it patient-centric. And one of the projects that we have in our portfolio is the Swiss Patient Journey Ecosystem Map. This map illustrates the different solutions among the Swiss patient journey. So this also allows to understand the complexity of the Swiss ecosystem, and it also helps to find synergies between the different organizations and enhance collaboration. We update this map regularly 4 times a year. Next update is planned in the end of September. And it's categorized in different parts, such as health monitoring, data interoperability, prevention awareness that we are looking at today, medical data history, and healthcare interactions. So in the past months, we've already highlighted some categories. This is actually the 4th of 5 categories we're looking at in the form of a webinar. And 2 of our panelists today are within the category of prevention and awareness. The Careum Center for Health Literacy, as well as kinastic. And of course, we also have Promotion Santé Suisse. They're not in the map, but they will also very much give a lot of insight into the topic of prevention. So yes, without any further ado, I would like to move on to our topic of today and to the introduction of our panelists. Thank you very much for taking the time over your lunch for this webinar and for this exchange. So we have Saskia de Gani. She is head of Careum Center for Health Literacy. Then we have Raphael Kubli. He's a co-founder and CEO of Kinastic. And Raphael Tremeaud, he's head of prevention in healthcare at Promotion Santé Suisse. So I would actually like to give the word to you and start off with asking you, Saskia, if you could tell me about your organization and your activities and how it actually enables understanding and access to knowledge in health.
Thank you, Cecile. I brought a slide with you, and we are a Careum Center for Health Literacy, which is part of the Careum Foundation that wants to promote education in health professionals. And you see here that we always focus on databases and data evidence. And as the topic of today is digital health literacy, mainly I brought you the latest Swiss data on digital health literacy in Switzerland, and you see that there is a huge need to support our population in all the tasks regarding to digital health and decisions and behavior. And what we do is actually we try to get data, we try to develop data. So we do research on the one hand, but even more, we want to transfer this knowledge that we gain into practice and into policy. So that means that we are also working together with practice partners from the field, mainly at the moment in the ambulatory or ambulant setting, but also in education of health professions, for example. You see that we work on different levels. So from the individual to the system level, where we mainly focus on organizations and health professionals, but really try to get a solution on the system level, as we think that we have the greatest impact if we work on a greater level than on the individual level. Yeah, that was it briefly.
Mm-hmm. Thank you very much, Saskia, for this brief introduction on what kind of activities you have. I would like to hand over to you, Michael, and let us know what your organization is working on.
Thank you very much, Cecile. Nice to meet you, everyone. My name is Michael, and I'm the co-founder and CEO of Kinastic. And at Kinastic, basically, our topic is we want to support companies somehow integrate important health topics throughout the company and motivate employees to adopt a healthier lifestyle right away. So we do that always in 3 steps. Those are our main focus that we have. First is always raising awareness. So we help HR people in companies to integrate important topics like stress management, resilience, movement, ergonomics, nutrition, like very holistic approach that we have to create the awareness on the employees level through campaigns that we prepare for the HR. So also we try to somehow minimize the workload of HR so that they can easily spread all important topics all over the channels that they have, the communication channels that they have within the company. On a second step, we help the employees to transfer knowledge. So the idea is that they can, through webinars, through articles, and also expert videos, access knowledge that they need in their everyday life. And as a third step, we do not only want to transfer knowledge, we also want to help them to integrate that knowledge in their everyday life. And there we basically offer a platform, an app that is more or less like a digital health coach that guides them through their everyday life and helps them on an individual level to get into a healthier lifestyle and to motivate them along the journey. One of the questions that you also asked was like, how do we enable understanding and access to knowledge in health? And I would say we differentiate ourselves a lot since we do not target private individuals. So instead of someone downloading an app at home alone and trying to start their health journey, we are focusing on companies. And within companies, the good thing is, first of all, the company pays for the solution. So it's free for everyone. So there are not any entry hurdles for people. On a second step, the good thing is in a company, there are teams, so people know each other, so they support each other and can motivate each other. That's something that we leverage a lot. And of course, as an employer, you can also create team challenges, reward people for healthier lifestyles, and we use all that to really make it or enable people to take more care of their own health.
Very interesting. Thank you very much for this short introduction of Kinastic. Raphael, I hand over to you to tell us what you do at Promotion Santé Suisse.
Thank you for this invitation. Perhaps first about the Health Promotion Switzerland or Promotion Santé Suisse. We are a national foundation which holds a federal mandate to initiate, coordinate, and evaluate health activity, health promotion for all the people who live in Switzerland. We've got some fun, and the goal of my team, there is many team by Promotion. We found some project for the Swiss population with a particular focus on prevention in relation to chronic diseases. And of course, at this point, and yet, is digital health intervention or this kind an important issue actually in Switzerland. So we develop some kind of guideline to inform people about what is possible. We are dealing with some process where really to make significant or an impact for the population using also digital intervention. It's not the main focus of the foundation, it's one of the topics we are dealing with. The digital intervention could be a coaching application, information platform, of some of the tool for sharing information or good practice with patient, family member, and of course also health care professional who are using it. Digital public health intervention are for us one of the priority, one of the focus of the support actually. But you can find also more details on the project we actually support on the website of the foundation. Thank you.
Thank you so much, Raphael, for this short introduction to the activities of Promotion Santé Suisse. Very interesting also how different this topic can be addressed and approached. And this is also why this webinar is absolutely crucial. I would actually like to take a step back, as we now heard how you are approaching this issue and how it can help patients or also healthcare professionals. I would like to know from you what main hurdles you've encountered in raising awareness about health literacy in Switzerland, or bringing health literacy to patients. I would like to start with asking you, Saskia.
Well, actually, one issue is that the term is not understood, or is differently understood. It's also mainly a theoretical, for some also difficult concept. So one hurdle is first to get everyone to understand the same under this term health literacy as we do. And there also comes in the language. So if we speak in English, you're talking about literacy. The translations in German, French, and Italian go more into competences. So it's more like health competence in the translation. So we already see there that literacy and competence are not the same. So it's not only about dealing with information for us, it's even more dealing with health services and the challenges we are confronted with in our time nowadays.
Mm-hmm.
And other hurdles are, of course, that you, if you want to promote this, you have to coordinate a lot of stakeholders and to get them together on one table and to reach the more vulnerable groups. I think these are the three hardest challenges.
Do you want to add anything, Raphael or Michael?
I think just health literacy is not one topic. There is a lot of topic with the ability of people to join an application, to have access, to gain knowledge, and the ability of the professional, like Saskia mentioned, all the stakeholders to put on a table or to discuss and to have the same language. And it's quite a bit an issue for all the project. If you are dealing with some hospital who want to develop an application, they got to deal with IT specialists who performs one application with a technical approach, and you get to deal also with patients who don't care about what is the technical approach with behind your application. So I think this kind of thing like health literacy is really a vast topic with not only about technology, it's really about some kind of dealing with people, dealing with stakeholder, and also, of course, dealing with politics and dealing with money, because all this kind of application have a value, or there is some business model behind there. It's not a critic, it's a fact for us too.
Mm-hmm.
I would actually fully agree to that. And thank you very much, Saskia, that you mentioned especially the languages, because even I had to quickly dig into like, okay, what could it potentially mean with health literacy? Like, what is my understanding of it? What do others understand? So I would say that's anyway a huge topic for Switzerland especially, because also when we approach companies, I mean, we have to deliver everything in French, in Italian, in English, and in German, and that makes our lives always harder to build awareness somehow inside of a company. And then I would also say a big hurdle, especially on in our case on employees, but in general on citizens here in Switzerland, I would say is you have very different levels of health awareness and tech savviness. So I can give you a very good example. We work with, for example, lots of companies that are white collar companies, so people that are working in an office. But we also have lots of companies that are maybe from an industry, for example. And the difference in the level of awareness that these people bring on the table is huge. So in an office company, you feel that those people are way more aware of their health than, for example, industry workers or workers on a construction site, for example. And along that, also tech savviness is a topic. Of course, people who are working in an office, they are more tech savvy than people that are working maybe on a construction site. And especially with digital solutions, it's not always easy to find something that fits everyone.
Yep.
And what you also mentioned, Raphael, I guess if I remember correctly, is also a bit the trust issue, like privacy concerns, especially when it's about digital solutions. I mean, still health data, so lots of people they have their concerns in sharing data that is actually for us as a provider very important that we can work with the people, but they are not willing to share it because they are scared of what happens with the data. That's also one of the hurdles that I would say are out there.
And in that case, it actually means it's also what you, Saskia, mentioned with the vulnerable groups. It just takes a lot more effort to actually try to include them in this health literacy journey.
Yes, of course, because they are hard to reach. Also, what Michael now said, it's about the awareness of health, which has, and also health literacy has to do with educational status. So I guess that's one point, and the approach to health issues, and on the digital side, it's even more difficult to assess trustworthiness, not only for well-educated people, but especially for less educated people.
So what I would be interested in, you just mentioned it a little bit, Saskia, but as you are the head of the Center for Health Literacy, and we at Digital Switzerland are mainly also looking at the digital aspects, would be interesting to hear from you. How do you rate the importance of digital in health literacy as a whole?
Yeah, I guess it's even more important. It's increasingly important. I'm not a fan of dividing between digital health literacy and health literacy. For me, it's just a natural part of health literacy, but you can focus on it if you want with research or applications. But with all the technology that is increasing, with all the digital channels we have to ourselves produce health information, so it's not only produced by others, but we can produce it ourselves. We can distribute it on several channels, like also social media. So the digital part, technology part, becomes even more important, all together with digital health, with own data, with health data, who it belongs to. So we really have to navigate through a digital ecosystem regarding health data, health information. So I think it gets even more important, it gets even more complex. And also the competencies that we need to have to deal with it develop or change. And it comes to critical thinking, it comes to being able to cope with rapidly changing knowledge, for example. So I think it has a huge importance.
Mention it, one of the big part of this topic is also to deal with patient or final user, as you mentioned, but it's also to include them in the process of developing one application, developing something, because we are currently dealing with about, I don't know, in public health, perhaps 10 or 20 stakeholders, but we got to include first the patient. And it's really an issue, because by developing one application is perhaps also to deal with 20 stakeholders, and we get to put the patient and this issue in the center of the discussion always. And it's a sort of effort in this system with about dealing with canton, with federal level. I don't know how many stakeholders, but the patient get to be at the center point and got to be included in the discussion. And it's quite tricky sometimes for the project to have a good idea and to have a patient who say, I don't care of your application, I don't want to use it. It's really an issue and also a challenge, I think.
And I think it's not only about patients, it's about every one of us. And for me, that starts at school.
Yeah, I mean, at the end of the day, we are all patients, right? Sooner or later. So I agree that the sooner we start, the more opportunity we have to include everybody. So Michael, you are kind of, as you said before, you are engaging more with organizations that then include all employees on their health journey. So could you tell us what are the main reasons for organizations to actually engage with kinastic, and maybe also why do some not engage, next to maybe the financial aspect?
That's a very good question, and I can tell you a bit also about what we have been through. I mean, we are a startup, right? So we built the solution, and along the way we had to learn on also how to sell this solution and to whom brings it value and to whom are we selling it to. So I can tell you, I hope everybody of you is familiar with the term product market fit. That's something that we just found in this year, actually. So last year we were still having more or less the same solution as we have today, but we just told the story wrongly and to the wrong person. So I can tell you, like last year, we were always talking about an app, about the platform, and that goes a bit hand in hand with what Saskia said before. For me, it's not about a digital solution or something in general that supports health. A digital solution or an app is just a tool. It's just something that supports you, but it's not. It should not be differentiated. It's still something. It's like a service that helps people getting healthier. And last year we basically were always selling a platform to the HR person, and our pitch was, hey, if you implement our tool with your employees, these people will be more engaged and taking more or more responsibility of their health, and they will be more motivated. And in the end, your absenteeism rates will go down. So the pitch was, with the tool, you make people healthier, and in return, you can save money because they are not ill. And then we figured out somehow, hey, the HR person, yes, of course, they take care of their health of the employees, and it's important to them, but it doesn't really, or our solution was not really solving them a problem. And then we were asking ourselves, like, okay, somehow the HR person is like a doorkeeper. We have to somehow deliver value to the HR person so that we can access the employees to then fulfill what we actually came for, so that we can make people healthier. And what we did then is we realized lots of HR people, or in general companies, they would love to do more about employee well-being, but they don't have time and they don't have money. And I mean, providing people with lots of different topics, from mental well-being to exercising to nutrition, it can be a lot of work. So you have to somehow create the content, you have to nicely pack it, send it to the employees, you have to make sure that they stay engaged, you have to on a regularly basis communicate things. And we figured out that HR would love to do that, but they don't have the resources. So we provided them with a tool where we can somehow automate campaigns for them through all the channels that they have. And now somehow it switched, because then now the HR person is listening, because we solve a problem of them, to make their everyday work life easier. And through that, we get actually access to the employees and can fulfill our mission on somehow increasing their health. And that was very interesting to figure out for us, like how can we actually, our mission is to make people's life healthier, but how can we sell it and still earn money, because we are a company, so we have to earn money somehow. And who can we access the people that we actually target? That was a very interesting experience for us.
Very interesting.
It covers both questions that you were asking.
Okay, so that means you have customers almost breaking in your door by now, as you figured out the...
I would not say breaking into doors, but it's growing heavily actually compared to previous years, definitely. Yeah.
Very nice.
And we are still doing the same. We just are telling a bit a different story, and that was a big learning or huge learning for us as founders. Yeah.
Very nice. Thank you so much. So I have one last question to you panelists before we open up the Q&A. I would like to just shortly hear from you what your vision is for the future of the Swiss healthcare system in a few sentences. Raphael, do you want to start?
You mean the future for digital health or future of healthcare system? Because it's quite, I think digital should be or could be or will be a big part of the health system. I think it's perhaps a sort of answer to some problem we are dealing with the lack of professional, with the engagement, with the financial support. I think prevention and health promotion, we get to have more money to support that in Switzerland, because it's make for me a difference between well-being and prevention. But I think what Michael mentioned is for me also a little bit like prevention, but I think we got to invest more money in that, and people have to gain access of their access, control, and power of their own data. And for that, we need some kind of new regulation, a sort of new deal with this digital trend with coming with also here. So now, thank you.
Thank you, Raphael. Saskia, do you want to go next? It can also be very bold.
Yeah, well, actually, I agreed what Raphael said. So for me, the system should be turned upside down. So we start with health promotion and prevention and come a little away from that curative view. So we are always talking about healthcare and not about the health of it. So for me, it's also about well-being. It's about improving quality of life, and not only of our human lives, but also of the animals and ecosystems. So really also going more in the One Health directions to save a sustainable life for every one of us on this planet. And for me, that comes together with coordination on a national and cantonal level, sitting and working together with different stakeholders, integrating, of course, the people, the community, the population at different levels. And yeah, that would be, for me, the vision of our system.
Thank you, Saskia. Michael?
Thank you. Yeah, I fully agree with both of you. Actually, I actually prepared more or less exactly the same. So our vision is as well a Swiss healthcare system that embraces prevention as much as treatment. I guess that's something that in Switzerland is we are very much focusing on treatment and not so much on prevention. And I would love to see that change in the future. And then on the other hand, I also think we have lots of players here in Switzerland that provide solutions, and there are, as I mean, you have shown before also the map. I mean, you see that there are thousands of solutions out there, and in my eyes, it's a bit the lack of clear centralized information. So for patients or for people out there, I would say it's very difficult to figure out like what is the right solution, and there is no connection within the solution. So I envision something in the future that providers that support healthcare in Switzerland, that they work closer together and are more aligned with each other, because I mean, it's clear there is no one solution fits it all. So there have to be different solutions, but somehow it's a journey that someone goes through, and each of those tools supports you in some part of that journey, and that needs to be well aligned. So I hope that this happens even more in the future.
Thank you. I mean, it's very nice to hear that all the speakers are aligned in this vision for the Swiss healthcare system. I would now like to hand over to you, Jade, for the moderation of this Q&A. Anyone who has a question can either raise their hands and ask the question themselves, or feel free to also just ask the question in the chat.
Perfect. Thank you so much, Cecile. I saw one very interesting question as well in the chat. Thank you, Antonia, for sharing that one as well. Regarding a bit the difference between male and female regarding digital health in the interest, but also in the adoption, if there's any factors that you would recommend regarding adoption rate. I don't know if one of you three has some experience or data around the difference between interest and adoption between male and female. I don't know if one of you three has something to share there. I see Michael nodding his head. Maybe you have some elements here.
Yeah, it's interesting. I mean, we are always looking very closely about the data of who is actually using our tools and what are they doing, etc., and who are our power users. And it's interesting to see that the power user is actually a woman within 36 years old and 45 years old. So that is above everything else. And also that's actually in two directions very interesting. First, from the age, because one could think digital solutions attract especially very young generations, but as it seems, especially in our case, it's more like the midlife ages that are interested in our solution. And it's very interesting that it's more more women are using our solution. And in general, also when I have speeches or in front of employees, for example, I have the feeling that there is always a higher interest and openness from women than from men. And I don't have to answer why this is the case, but it's the case.
Perfect. Well, thank you, Michael. I know, Saskia, you do a lot of studies as well where you capture the different literacy levels between different parts of Switzerland. I'm sure you also maybe have some data around there. Would you also agree with Michael that female a bit in between 35 and 45 are maybe of the most interest, or are the data showing a bit differently on your end?
Yeah, we do not or did not measure interest, but what we see and interpret is like that females tend to report lower health literacy levels, meaning they report more difficulties in dealing with health information. And we interpret this that they are more aware of it, they more have more interest in it, so they even more know how complex the issue is and therefore have the lower health literacy levels than men have. And what we see in data is also that females go often to a doctor or earlier to a doctor, are more into preventive measures than men. So that's what we can see from the national data.
Perfect. Thank you so much for sharing. Also, someone was raising a bit, asking about how people were concerned about their data privacy regarding their personal information. Is there anything specific that you would mention regarding that? Because I know, from our side as well, we also do some research around this, and it is true that a lot of people do raise around data privacy, but it's still a willingness for people to actually onboard digital solutions to capture health. Is this also something that you have realized in your work, or do you have other points to share as well? I don't know if someone, Raphael, maybe?
Just an overview, but one of the big concerns is also by people and by stakeholder or healthcare professional who are willing to have a sort of regulation or ethical approach into developing a new application in digital or some digital device. It's always an issue in the project we are actually funding, because quite sometimes I feel a sort of insecurity, or people are willing to do something, but they are asking themselves about it's a big issue and it's a big concern also for healthcare professional. And there is some regulation who are coming for a digital application or medical device, and it will be an issue. And I think all the stakeholders get to have that in mind if you develop a sort of intervention or application.
Perfect. Thank you very much. Also, a question from Michael in the chat. So wondering a bit how better health literacy can actually help people navigate better the health system. And would this actually have a role to play in the decision process to turn the system upside down, as Saskia was mentioning, to go really towards prevention? So do you believe that really, if the population is made more aware of their health, this will really kind of is the leading point to transferring the system into a more preventive direction? I don't know if one of you wants to comment on this one for Michael.
I think one of the goals of prevention or health prevention, it's really a major topic, health literacy. It's really a major point. And I think of that engaging people is one step. There is other step, engaging stakeholder, engaging all the people. But yeah, it's quite an issue and it's really important. You're right.
And I guess it starts really early, because as we grew up, and I'm talking just now for Switzerland, but you grew up and you're healthy, so health is no issue. And then when you get a problem, the issue of health comes in, and you learn to know the healthcare system and how to cure, but it's not a value that we are used to, as a child, that we have to do something to stay healthy and to know and be aware about the value of health. And I guess it should really be turned there, so that you really have health in early education as a topic, and you know how the health system functions. And then we are talking about the navigational health literacy. So I guess it starts there, and then we will also develop more preventive and health promoting interventions right from the start, and know about it and get people engaged.
Mm-hmm. Perfect. Thank you very much. Interesting question also rising up in the chat from Peter. Maybe we can all put our hands up from the chat. Was wondering who of this group, because we do have a lot of people very highly interested in health and digital health, who actually has opened an electronic patient record. So if you have done so, would I kindly ask you just to do the raise your hand on Zoom, so we can just have a quick view. I'll give you all a minute to do so. Okay, so we don't have so many people with a health electronic patient record.
Eat your own dog food.
Perfect. Okay, so we do have only around five people that have one. So,
and why is it? Why is it? That's the follow-up question.
That's, I think, maybe if people want to add their comments around this in the chat, because I think otherwise it might become a bit complicated for the group. But indeed, could be an interesting one to comment on why you've decided not to open one for the time being. Following there, I think there's some question as well regarding more the activities that are running in Promotion Santé Suisse and at Careum. I don't know, Saskia and Raphael, if you could comment one or two words about the current projects that you're really focusing on at the moment within both of your teams. I don't know who wants to go first.
I can start actually with a project that is also together with Promotion Santé. We are developing, for example, an ambulant patient letter, which is given after a consultation with a doctor, which is digitalized and individualized and really fits into a normal consultation of a doctor. It's now developed within chronic back pain for a pilot study. So we really want to support patients in their understanding of what happened during the consultation, what further steps are, what they can do as a preventive measure, what they can do for their self-management at home, so that they really can take that back home. And of course, we evaluate if that works, and want to scale up that for other settings and issues, as an example.
Perfect. Thank you, Saskia.
Perhaps one other example is to document the chronic diseases. I don't know, people living with diabetes, they can have a sort of support using a digital application or digital intervention to have a sort of platform to monitor their chronic diseases, because we all know that one of the fact actually is that 80% from healthcare support is really given to people with chronic diseases. So it's a major issue, non-communicable diseases in Switzerland. Another issue is, for example, to have mental health support for young people, who can be given through digital intervention or application, who is quite interesting. And to have a sort of, we have 10 or 20 applications in different, but I will mention to really chronic diseases is a major issue, also in company, because you got people who work with chronic back pain, I don't know, people with diabetes, and also mental health support for young people, who is really an issue. And we have seen that since COVID and all this kind of stuff. Yeah.
Perfect. Thank you very much. Also, a bit of a follow-up questions to some of the discussion we had a bit earlier regarding the fact that it is quite complex to also involve vulnerable groups, and that also due to the data, vulnerable groups tends to have lower digital skills. Some people in the chat were also wondering a bit, how are you trying to tackle, because we were talking also about the fact that it is very important to involve the patient, the citizens early on. So how do you enable to make sure that vulnerable groups are also part of these discussions, part of the way forward? Is there any specific requirements or factors that you're putting in place to make sure that they're also part of the exchange?
I think one of these points is really to involve them at the beginning and to carefully listen to the people and what is the need. Because we are also sitting in Zurich or in Bern or in Lausanne with project, but we get to carefully listen to people and what is the need actually, because sometimes we come with solutions who don't make it. Just the point, and to listen and to have a sort of understanding, and I think it's one of the points.
Do you therefore sometimes organize, I don't know, sessions where you invite really people out of the population to come and share their information, or is this more kind of a fact, or is there some processes or elements that you're already putting in place for the developments of at Promotion Santé Suisse or at Careum, or even with Kinastics? Are you also trying to go towards these more vulnerable groups and involve them actively?
I think one of the points is, for example, to include a patient in a project development. It means when someone comes asking a support, they sometimes come in the interview with some patients. And regarding that, I think it's a good practice, and everyone who wants to make some kind of empowerment of the patient get to involve patient into the first step of the process. And it means for us, for financial support, we got some criteria about that. Is there any patient who is in the discussion for the funding? Yeah.
I guess we really have to go to the community and involve them, invite them. We try to do that also with stakeholders, dialogues, or even events on health literacy. Always invite patients. And here I think it's really important that we fund them, because they are already patients and we get our payment, but they don't. So that, and I guess that's also for project funding really important in the future, that this is acknowledged and that can be part of a research proposal, that as well as patients or just the community gets funding for their work together with the experts. And I mean experts, well, the academic experts or whatsoever, they are as well experts of their lives. And yeah.
Perfect. Thank you very much. There was also a question regarding the support that digital health solution can have in making life easier for nurses, taking care of older stakeholders. Is this also something that you have acknowledged or that you have experienced, that there is also this that digital health solutions have this role and impact in supporting nurses in their daily work, especially towards the elderlies? Otherwise, if no one has an answer, it's also fine. Then I'll follow up with a question more to you, Michael, regarding the realization you had around female around 35 to 45 being more responsive and so on, and the discussion we were having a bit before. Someone in the chat was also wondering if, therefore, at Kinastics, you have adapted your UX UI to target the different groups, or is it kind of a general look and feel for all the population, or is there a bit of a specific development depending on maybe your age group or your sex or your preferences in one or another topic?
I would say from a user experience perspective, at the moment, we just always strive to make everything as simple as possible. I always say, even within my team, I always say, if my grandmother understands how to use it, then we are safe. So we really try to be there as simple as possible. But at the moment, we were not able to focus on having different user experiences for different user groups. But it's just a resource problem. So in the future, I could definitely imagine that. And I think it's also something that would be necessary. What we do so far is more on the content side, since we are fully on the preventive side. So all the content that we provide is always for different level and for different people. So yeah, especially within a company, you have from a 16-year-old apprentice guy to someone that soon will go to the pension, and yeah, you have to somehow adapt, and you have to have or to offer content that for each of those groups. And we have, for example, health content for women's health, for men's health. So the idea is to really be as broad as possible content-wise. And then you have like smart algorithms that provide the specific person using the solution with the right content for them. So at the moment, we are more making differentiations in the content, but not yet in the user experience, of like from the usage.
Mm-hmm. And is this something that you would want to plan in the future, or is this on your horizon for the future?
Definitely. Yeah.
All right, perfect. And also another key question, we were talking a lot about, at what stage do we want to start the prevention? And we were talking about trying to actually include it as well in the education process. Are there already, to your awareness, certain initiatives or actions where teachers are actually already starting to grow health awareness within children of young age? Do you already have some knowledge around such initiatives, or otherwise, what would be some thoughts around how this could be better handled in the future? I don't know, maybe Saskia, you have some inputs there because you were mentioning that in the beginning.
Well, what we see is that just other countries are far ahead of us. So Germany, where the ministry funds a lot in these initiatives, or the Nordic countries, like for example Finland, they have health literacy curricula at the basic school, or just health as a topic. And I mean, it has to be health as a topic mainly on itself, but it has to do with media competencies, with digital competencies. So connecting all these issues together, and it could start to just talk with the children about health or about mental health or something like that, but just raising awareness, talking about the topic, and then the question come up, and that can be co-produced with the children, I would say. And of course, it would be great to more specifically and systematically start initiatives in these directions, but they are not that far ahead. And we also have to admit that we have a research gap, at least for Switzerland. We don't know about health literacy in youth or in children.
Mm-hmm.
And we know about 18 plus. And it's a gap that we at Careum want to close together with another University of Applied Sciences. So we have applied for funding, and we hope to get that to close this gap and to really take measures that are efficient and evidence-based.
I think we also provide at the foundation the body mass index activity for youth people. Every 2 years we support a study about that. There is also in each canton of Switzerland activity and program about physical activity and about also nutrition were specifically given to young people. So it's a major issue, like you mentioned it, in health promotion and prevention, and we can do more. And I think there is a lot of program and support for that. Not enough, of course, but it's an ongoing process. And also one of these issues is really the federal constellation of the stakeholders. So you get to develop, if you want, you get to develop a program in 26 cantons. It's quite a challenge also for people. Yeah.
That's true.
Or what I find personally very interesting is we have often schools that approach us for the teachers. So they want to work with us to help teachers being more aware about the topic health, or to strengthen the mental well-being especially. And often when we talk with them, at some point they say, but hey, actually it would also be interesting for the students. But then it's always the second question is then, okay, who pays for it? So there comes the problem that then it would, because it's a huge user group, then when you would include all the students, it would get quite expensive on our side. And unfortunately, it's very difficult to provide them with a solution that they also can use it for the students. But the knowledge is there, so they would love to do more. But the question is just how could they afford it?
Yeah, I think, I can see how budget can always be a bit of an issue, but at least it's good to know that there's the interest at least coming, starting to come as well from their end. The last question that we'll pick up from the chat before a few closing words is regarding a bit, there's a huge influence of a lot of medical devices or non-regulated medical devices kind of popping up, lots of different applications, platforms in the market in Switzerland. What do you think, to what range do they have an influence regarding health awareness in Switzerland? Do you have some inputs there? So are they playing a big role, or do you think they're more confusing and actually not being used to their biggest advantage? Do you think they are starting to pick up and play an active role in health awareness in the future? I don't know if one of you wants to comment here.
I think what you mentioned is two topics. There was one thing about medical regulation. It will come more medical regulation for medical device, and it's needed for the people, because there is sometimes a little bit of Wild West between applications who are collecting data, and I'm not focused on you, Michael, no problem for that, but really, we need some regulation. And if people use an application, it's success. If they don't use, it's a fail. But I think it will be more important and interesting for us to develop one application in Switzerland. It could be really a challenge, but a measure will make a lot of sense for all the people, yes.
And I can comment on it as well. I think it increases confusion a lot. So a lot of people now track their sleep, and they see, oh, I don't sleep well according to my watch, but I feel well. And they get confused and really go to doctors. So there actually comes in again the issue of health literacy. Of course, it's a chance to raise awareness on health. So I see both. But what I even more see is that people don't want to share data, but that data they share with big tech companies. And I think the Federation, or the Swiss Federation of Public Health, is not that aware or doesn't take measures so far. So the big tech companies do have a lot of data on health, which are not the data of ourselves as patients. And I guess that is a big issue we really need to regulate soon.
Yeah, I agree. Well, thank you very much for all your questions in the audience, for your great answers as well from the panelists. Cecile will just quickly share the screen again. We would love for you to just quickly answer on our Mentimeter a bit what kind of key learnings you're going to take away from today's session. From my side, it was really a great pleasure to kind of see the different perspective, as Cecile was saying, really having these different kind of meta layers. And I think, as mentioned, there's really this need of now changing the system, the healthcare system. So for me, that's going to be a big takeaway, is really having to reshift a bit the way that we've been thinking for the last 100+ years, and really shifting towards a prevention first, treatment second kind of perspective, and really going into the whole topic of empowering since the earliest age and on every level. So I think these were two very important, I think, takeaways, but happy also to learn from yours as well. So Cecile will now share the Mentimeter so we can actually see quickly the answers. And yeah, thank you very much, everyone, for taking the time today again during your lunch break. And we're really happy to see always some familiar faces and also some new ones. So we're starting to see some answers. We see that, yeah, there's huge challenges still existing for prevention. I do think, as Saskia mentioned, we can learn a lot more from other countries as well, because we don't need to restart from scratch. We could, a lot of elements are similar from one country to the next. Let's see if some other answers are coming or if everyone is already slowly having to drift to their next meeting or appointments of the afternoon. All right. Yeah, there's also the collaborative approach that, as we said, all stakeholders need to work together. We need to change the mind shift of the culture. So a lot of these things that were covered during the webinar as well. But I won't keep you all waiting too long. You can all slowly go to your next meeting. Thank you again so much for your active participation, your questions, and especially to our panelists and to Cecile for a great session today. Thank you very much.
Thank you all very much.
Thank you very much.
See you soon.
Thank you.
You.